Well, great job. First off, could you just talk to Americans about how it will impact them if we go to a single payer, a government insurance plan, things like that? How just apply to the individual.
Well, the first thing that they'll find is that they have to get used to queuing. That they turn up and instead of getting treatment, they're told to come back, 6 months' time, 8 months' time, a year's time sometimes. Those are the waiting times we have for hip replacements, knee replacements, and so on. The second thing they'll find is that they are less likely to be made well. And that isn't just me. I mean, you could talk to anyone and get their anecdotal evidence, right? But look at the statistics on this. If you get prostate cancer in the UK, there is a 1 in 4 chance that you'll be dead in 5 years. If you get prostate cancer in the US, there is a 0% chance that you will be dead as a result of that condition 5 years further on. Same thing with breast cancer, same thing with heart disease, same thing with stroke. The statistics are pitilessly clear about this. This is a country where you would rather fall ill.
What about getting drugs and like Avast and things like that? Do you have problems getting drugs in the UK?
It depends where you live. It depends on your age. It depends on your condition. But the scary thing is that if the decision goes against you, that's it. There's nothing you can do about it. So you've got a government bureaucracy basically coming between you and your doctor and telling you what is and what isn't permissible. And if you then try and go outside the system and say, well, I will purchase the forbidden drug myself, they withdraw everything else. They say, well, you're on your own then. You're a private patient and we're terminating the course.
So does just the system have to put a price tag on your life? Is that what happens?
Effectively, yes, and not because people want to do that, right? People are not horrible people.
Yeah.
Good people have to do it. But how else are you going to allocate limited resources when there is unlimited demand? Somebody is going to have to be told that they can't do it. And as well as being bad for the patient, imagine what it does for the person who has to make that decision. So it's a pretty awesome power, literally a life and death power potentially. So you're putting into the hands of the committee.
Does it help you if you have the right connections, things like that?
No, I don't. Well, I mean, it may help if you are working at a hospital or something, but no, it's mainly a question of where you live, random chance, what the budget was for that hospital in that year. I'm not saying that this doesn't happen in other systems. Of course, resources are limited everywhere. The peculiar feature of the British system is that there's nothing you can do. If the decision goes against you, that's it. Whereas under the US system, you still have the power to go somewhere else and say, well, if I don't like what this doctor is telling me, I'll try this one. And that puts you in an incredibly strong position, but also it means that the doctors are better because they're competing for your custom.
And then what percentage of your population works for the government in healthcare? Is it a big percentage,
The NHS is the 3rd largest employer in the world after the Chinese Red Army and the Indian National Railways. We have 1.4 million people, a population of 60 million, who work for the NHS, of whom a majority are administrators. So there are more bureaucrats within that 1.4 million than doctors and nurses. Exactly.
So all administrators.
They're not all administrators, but it's a pretty extraordinary thing, and it has not happened in any other system in the world that I'm aware of, that you have more administrative than medical staff.
So if America goes down the path of a government-run system, can we ever get out of it?
Well, the experience is that our experience anyway, is that it's very difficult because you have this vested interest, you have so many people who depend on it, and even though they are doing badly, they become very resistant to change. There's one argument that I won't use against the NHS. It is surprisingly cheap, given that it's a state-run system. You'd expect it to be much more expensive than it really is. And why is that? Because it is able ruthlessly to exploit its position as a monopoly employer. So the nurses, the hospital porters, the cleaning staff are badly paid in a way that it would be unthinkable here. And yet perversely, these are the people who are brought out in strikes and in protest to oppose any reform from which they would be the chief beneficiaries.
Doesn't make sense.
No, it's how people are. You are scared of the potential of change, not least because you see Michael Moore coming and showing films saying that everyone in America is dying because you have to buy your way into hospital, and if you don't have insurance, you're kind of left bleeding on the streets.
Yeah. Well, thanks a lot. Thanks for all you do.
My great pleasure. Thank you.
Bye-bye.